a couple of things here. Number one, I want to send out a message to my community here that this COVID-19 problem is real. COVID-19 is a real problem. It's not imaginary, because I think there is still a lot of self-denial amongst many of my community members that this thing doesn't exist. It actually does exist. Personally, I know friends in the United States, I know friends in this country who have been affected by the COVID-19. So I want to send out that message, and I want to tell them that this thing is real, and they must really try to follow the Ministry of Health guidelines in how to protect themselves. That's number one. Number two, then comes a question of what is going to happen now that the government has reopened business here in the Mara. I'm a very worried person, and I'm worried because with lackluster attitude towards COVID-19, and some people feeling like it's propaganda, it does not exist. I worry very deeply, because I know that this community faces very real threat, especially as we get people coming from epicenter areas like Nairobi and Mombasa, and probably other countries coming to the Mara. As we are beginning to see, the community here is going to be very, very exposed to people coming from places that are adversely affected by COVID-19. So that's point number one, and I'm very worried. In fact, this is very serious. Number two, you have to realize that traditionally this community has been left without access to health care. There is total neglect here, and we don't have healthcare infrastructure here. I think there is only one health clinic here in the Mara. It's not even a government clinic, it's a CMF clinic. And between here and Masem and Narok, there is no government clinic here. So you can imagine a whole community like this one, with the largest number of visits by international people, by foreigners, as well as nationals of this country from other parts of the country. This community is very vulnerable, and the risk is very high, and I'm just praying to God that God protects them, because there is very little help this community is going to get from the government in the case of COVID-19 outbreak. There is zero medical infrastructure here. I think Mara guides, Maasai guides who live here, I want to appeal to them that they should pay attention to to the health protocols issued by the Ministry of Health. They are the frontline people here in the Mara, in tourism, and they are also the most exposed, even more than a gentleman who is herding his cows elsewhere. So what we want is, I want to appeal to them to make sure they get tested, not only once but regularly. I want to ask them to make sure they have masks, and good masks, not just clothes, which in fact do very little to protect the individual that's wearing them. We also want the government to actually bring this testing service closer to the people. There are probably about 4 gates here, which you must go through to get into the park, or 5. Is it possible we can have testing facilities in these gates? And again, I mean, there is a little bit of irony when we talk about availability of testing services here in Mara, because they still have to send these samples to Nairobi. So by the time those samples have gone to Nairobi and have come back here, the person would already be dead. I mean, there are millions and millions of samples, thousands of samples that are being collected every day. So we want the process for these people who are frontline people hastened. We want the process to be speed up. because we want the process speeded up, because it is not going to help anybody for the results to come back a month later or 2-3 weeks later. You know, we almost need like an instant results here, because if we don't do that, then these people, you know, you are sick today, you're infecting 50 people tomorrow and so forth. So there is a very real danger, and I hope that Mara Guides Association members and other guides take a lot of precaution. They should really try to, and we are in the process, Mara Guides Association, we are in the process of publishing, reproducing public health protocols, so that we can give it to them in our written in Maasai language for those who do not read English, and even just sharing this information amongst our members.